Currently, there are over 84 million Americans with inadequate access to primary care. And of these 84 million, 66% live in rural areas. After the Affordable Care Act went into effect in 2010, the number of insured Americans substantially increased, and this population is now aging into the Medicare program. So the demand for healthcare is growing faster than the supply, and this leaves our country with a massive shortage of primary care providers. Now, fortunately, the number of nurse practitioners, the majority of whom are trained in primary care, is on the rise. In fact, from 2010 to 2017, the number of NPs in the US more than doubled. And better yet, NPs are more likely than family physicians to practice in underserved and rural settings. So while the need for primary care grows, we have a growing NP workforce that's eager to meet this need. The problem, however, is that the transition into the workforce for new NPs is a very difficult one. Annual turnover rates for NPs are about 12% nationally, and that's twice that of physicians. So while NPs are being trained and are graduating in increasing numbers, clinics and other ambulatory health settings are having a difficult time retaining them. When researchers asked over 700 experienced NPs how prepared they felt to begin practice upon completion of their educational programs, fewer than 10% reported feeling very well prepared, and nearly half reported feeling either somewhat or minimally prepared. Alarmingly, 47% of these NPs reported practicing outside of their competence level during their first year. And you might be thinking, why is this? Aren't NPs fully trained in the classroom and clinical setting throughout their education? The answer is yes, NPs undergo rigorous training and education, but this doesn't mean that the transition into practice is an easy one. In the survey of 700 NPs that I mentioned earlier, skills like EKG interpretation and mental illness management were among the top competencies they listed as not having enough time to fully own before they headed into independent practice. After all, most NPs come out of their educational programs with only 500 to 1,500 clinical hours, while family physicians finish medical school with 6,000 and complete another 9,000 to 10,000 in their 3-year residency. So in addition to lacking sufficient hours of clinical training to feel comfortable with all the competencies that they need, new NPs lack exposure to some of the more longitudinal aspects of their role. NP students typically attend clinical only 1 to 2 days per week, and this makes it difficult to gain experience with skills like building a referral network and establishing sustained relationships with patients and colleagues. This lack of experience leads to an overall sense of low self-confidence among new NPs, and researchers have established this as a major factor inhibiting successful transition into the provider role. Now, it's important to also point out this is an expensive problem. The cost of turnover for a new hire NP is estimated to be $250,000 to $300,000, and the time to onboard and train them to 80% productivity is 12 to 18 months. So finding a way to improve nurse practitioners' transition into practice and to keep them in their roles for longer would be beneficial not only for new NPs and for the country's most vulnerable patients, but also for the financial health of clinics and other settings that employ these new NPs. So a solution to help NPs transition into roles and stay in those roles for longer is NP fellowship programs. NP fellowship programs are year-long training programs in which NPs receive intensive clinical training and supervision and learn to take on increasing patient caseloads. The first program was created in 2007, and there are now over 90 in the United States. So how exactly do these programs provide a solution to the problem that we're talking about? Well, first of all, I mentioned that a major factor affecting role transition is confidence. Many new grad NPs simply graduate not feeling confident enough in their clinical skills. But NP fellowship programs are very effective at filling this gap. The VA runs 16 primary care fellowship programs for new NPs, and they have researchers evaluate their programs. So a cohort of NP fellows and their preceptors were asked to rank the new NPs on 69 competencies divided into 7 domains, including clinical skills, patient-centered care, leadership, and several others. And they ranked them 1 month after starting their fellowship and again at the 12-month mark. And when the NPs were reevaluated in the last month of their fellowship, they showed substantial improvements in all 7 domains. Not only did they improve clinical competencies such as advanced care planning, the fellows gained new abilities in quality improvement, conflict resolution, and demonstrating leadership skills in the clinical setting. By the end of the 12 months, each of the fellows was deemed ready for independent practice. Now it's easy to think, okay, well, some NPs might need that extra practice and guidance, but surely others graduate feeling more skilled and ready to begin independent practice. But the competitiveness of these programs tells us otherwise. The VA fellowships have acceptance rates of under 20% and therefore are only able to accept students with the highest academic standing. So if these students at the very tops of their classes need additional training to become fully independent providers, the case can easily be made that all new NP students do. Now, some who argue against fellowship programs claim that new NPs get orientations from their employers that fill this same need. But again, the data tells us otherwise. Only 33% of NPs receive a formal orientation period in their job. And among those who do, it tends to be shorter and less thorough than what fellows receive. Finally, NP fellowship programs save employers tremendous amounts of money. The cost saving of hiring an NP with residency experience has been shown to be over $25,000 per NP as compared to hiring a non-resident. The Carolinas Health System in Charlotte runs the largest postgraduate NP fellowship program in the country. It began in 2013 when the chief nursing executive saw that the NP turnover rate within the system had reached 14% annually. So in this program, fellows are assigned to one clinic for the full year and work individually with preceptors. After careful tracking of 2 cohorts of fellows in this program, the Carolina Health System saw a 27% increase in general clinical knowledge from the beginning of the fellowship to just the 3-month mark. But beyond an increase in clinical competencies, the fellows demonstrated increased leadership abilities, such as an increase in preparedness to function as a team leader in code situations. And the financial benefits to the Carolina Health System have also been tremendous. Since the onset of the program, the turnover rate for NPs in the system has decreased by 50%. So if you're a healthcare administrator, I urge you to advocate for the creation and funding of nurse practitioner fellowship programs. Not only will this be of great financial benefit, it will help new NPs, and most importantly, it will help the country's most vulnerable patients who can greatly benefit from the care that NPs have to offer.